Why is it important, Jenny, for a patient to walk immediately after surgery? Like if a person had hip surgery or knee replacement, why is it they have to walk immediately? Hi everyone, welcome to our video on gait analysis. I'm here with Dr. Jenny Winter. She's a licensed physical therapist. Her specialty is gait analysis. So I'm here to ask Jenny about why is it important, Jenny, for a patient to walk immediately after surgery? Like if a person had hip surgery or knee replacement, why is it they have to walk immediately?
Yeah, so with the kind of progression of these surgeries, they've allowed it, our patients, they actually want them to get up and start walking usually the next day after surgery. The bones are set with the prosthesis, and it's safe to start weight bearing. After major surgeries like that, it only takes 2 weeks of decreased activity or bed rest before you start to see a significant decrease in muscle mass and strength. So keeping people moving, weight bearing, will limit the decline in strength and muscle mass.
So do you recommend them to use a cane or a walker, or I see those hospitals, they have those guardrails they practice with?
Yep, so initially after a major orthopedic surgery, they'll usually recommend a walker because the last thing they want is for someone to fall and then injure the new surgery or the recent surgery or cause another injury. So usually most patients will start with a walker, the standard four-wheeled walkers that you see in the hospital. But there are definitely different options. Sometimes younger patients or just more agile patients, they'll give them crutches. You can quickly progress to a cane in some instances, but the main reason to use any kind of assistive device is to limit falling, tripping, and to get people up and moving as much as possible.
Okay. So we have this walker here in front of us, donated by byAcre. And thank you, Acre, for your sponsorship. So there's a lucky veteran out there who's going to receive this for free. And so my question is, what do you look for in assessing the quality and functionality of a walker? I know there's so many walker brands out there.
So stability is the first thing. So you want a wide enough base so that no matter where they're bearing weight through it, it's not going to tip. So this one is wide enough. Wheels are far enough apart that you get that stability here. And then adjustability is also very important. This one is very easy to kind of adjust the handles, and it clicks in place so you can know that it's locked. But we want people standing up as tall as they can too. Help with posture.
So the hand position is important, not too high, not too low, just...
And PT can help adjust. We have little tricks of like where it should hit on the wrist, depending on if they don't have any kyphosis or any other posture issues there. But positioning, height is definitely important for walker stability and use.
I like this, the size of the wheel. I think you can, sometimes they have those curves or humps. And the wheel is pretty big.
These are thick enough that they won't get stuck in the cracks in the sidewalk. And it's very easy to turn these. A lot of the wheeled walkers, they go front and back, but they don't have the turning ability. So then the person using it has to have the strength to be able to lift the walker to turn it. Whereas this one, to use it, you don't have to lift anything.
Nice.
You can just kind of drive it there. But because it is carbon fiber, this is actually very lightweight for picking it up, putting it in your car, moving it, storing it.
It's nice. It's just less than 15 pounds, You could carry it with a finger. And it's like those mountain bikes. Size 29 is nicer going over the rocks, right? It's like the size 29, and the carbon fiber, they use it for race cars, so to make it lighter. So it's a very durable material. It's very strong, carbon fiber. So it also comes with a pouch, so it's nice. So if you have to put your wallet and like the seats too, so this is strong enough so people can sit on it to rest.
Yeah, so a lot of walkers don't actually, adult walkers don't actually have the seat. A lot of pediatric walkers do. But this is nice because if you were out in the community, you needed a break, you've got a chance to sit down quickly.
Okay.
And then worst case scenario, if you sat down and couldn't walk anymore, you can almost use this as a wheelchair. The person can sit, and then someone can push them while they're seated to get back to the car or get home or to a safe chair there. But the seat too is like a nice sling, pretty comfortable, but overall very easy to adjust and fold up. And
yeah, the nice thing about the wheel is you could pump air on the wheel, so it's light. Normally it's a hard rubber.
Yep.
So that's why it can be. I think that's that's how they made it light. So, but thank you so much for giving us some tips on what walker to buy in the market, and thank you so much for watching. So if you want a high-tech walker, so this is a walker by byAcre. Thanks so much for joining. See you next time.